Dementia. There are many types of dementia. The most common is Alzheimer's disease. 5.8 million people, or about 11% of the people over 65 in the United States, have Alzheimer's disease. It is the sixth leading cause of death in the United States. And costs related to Alzheimer's patient care in the United States are estimated at $550 billion a year. The incidence of dementia is 1% at 65 years old, approximately 3% at 70, 6% at 75, 12% at 80, 25% at 85, and 50% after 90 years old. But there is still hope for us all. The nun study showed that many nuns who were teachers and scholars were still sharp mentally at 90 despite brain scans showing anatomical atrophy of the brain, some of which were pretty severe. So participating in intellectually stimulating or social activities can keep our brains young despite loss of brain tissue. The opposite is also true. Lower educational attainment and social isolation are risk factors for dementia. 30 years of brain research has shown we can still get new brain cells even in our 90s, by learning new physical routines, such as sports and skills with our hands, playing a new musical instrument, or learning a Tai Chi kata or a ballroom dancing routine. Also, we can prevent vascular dementia by not smoking or abusing alcohol, taking cholesterol-lowering drugs, and keeping diabetes and hypertension in good control. Multiple studies have shown real brain shrinkage in alcoholics. Exercise is good for the brain and can not only help memory, but also depression. Prevent head injury when you're exercising. Get sufficient sleep and get checked for sleep apnea, which can kill brain cells, and I believe is a common cause of progressive cognitive decline. Hearing aids can prevent the well-documented cognitive decline from hearing loss. Get your vitamins obtained best by eating many different colored vegetables. Lutein is a vitamin that is said to help memory. Caffeine drinkers have less dementia and Parkinson's disease. There are studies that too much copper intake can lead to dementia, but a small amount of copper intake is important for our red cell production. There is a lot of controversy on whether aluminum causes dementia, as Alzheimer's brains contain more aluminum. Self-rising flours, powdered coffee creamers, pickles, spray deodorants containing aluminum may increase our brain aluminum. Diagnosing dementia. Memory impairment is no longer a prerequisite for dementia, but asking the patient what month and year it is, if they know where they are, if they know their name and the name of a family member in the room, is important. More important than checking memory is to ask the family about the patient's daily functioning. Can they do the usual household tasks or function as well at their job if they're still working? Can they find their way around, or did they get lost a lot? Patients with dementia will have decreased function in 2 or more of the 6 cognitive domains: complex attention, executive function, learning and memory, language, perceptual motor function, and social cognition. They may have apraxia and not be able to do a skill or a complex task they have always done with their hands at work or at home. They can no longer fix meals or play their musical instrument. They may have poor judgment and impaired reasoning. They may have trouble handling their bank accounts and trouble planning or organizing. They may have difficulty finding words, this is called aphasia, and difficult naming or recognizing objects or faces. Paranoia, stubbornness, agitation, and anxiety can occur, demonstrating a real personality change. They may be unaware of their own emotions, and they may have reduced insight. They can't learn or remember new information. Alzheimer's disease. Approximately 70% of dementia is from Alzheimer's disease. The usual onset of Alzheimer's disease is slow and insidious, but there is a variant involving more than the usual hypocanthal atrophy that can speed up the deterioration. Even early Alzheimer's disease can show decreased blood flow of the temporal parietal areas on fluorodeoxyglucose PET scans. And this can differentiate Alzheimer's disease from frontotemporal dementia. An amyloid PET scan can also be obtained, but 70% of patients older than 65 with a positive amyloid scan and normal cognition never develop dementia in their lifetime. The EEG shows a slow pattern in Alzheimer's disease. An MRI, if the patient will cooperate, should be done with contrast if the kidney function is normal to rule out infection and the memory problems and cognitive dysfunction in some patients with multiple sclerosis, and also to look for no more pressure hydrocephalus, which can cause dementia, brain tumors, or strokes. Atrophy in the hippocampus is not always from Alzheimer's. Early onset Alzheimer's dementia is a dominant trait passed on to 50% of the children of early onset dementia patients. If one first-degree relative has late onset dementia, the patient has an increased risk of dementia, but that is less than the risk of being homozygous for the apolipoprotein E epsilon 4 gene, a genetic risk factor for late onset Alzheimer's. However, one can still get Alzheimer's disease without having this gene. And having this gene does not mean one will get Alzheimer's disease, as ApoE4 has only a 50% sensitivity for identifying patients who will progress from mild cognitive impairment to Alzheimer's disease dementia. 23% of patients in the world have one copy of the ApoE4, and 2% have two copies. In patients older than 60, those with one copy of the ApoE4 allele have a 23% chance of either dementia or mild cognitive impairment. Those with two copies have a 42% chance of either dementia or mild cognitive impairment. Those with no copies have a 14% chance of either dementia or mild cognitive impairment. A spinal tap should be considered in patients younger than 55 with dementia to rule out vasculitis, cancers, neurosyphilis, or other brain infections or infestations. I will discuss all those causes of dementia in my second YouTube video on dementia. In Alzheimer's patients, the spinal fluid can show decreased amyloid B1-42 and increased phosphorylated tau protein, but negative results do not rule out Alzheimer's disease dementia. Patients young and old should have HIV testing, as HAND, which stands for HIV-associated neurocognitive disorder, can cause cognitive impairment, and 1 out of 50 get frank dementia. A study from Rotterdam in the 1990s indicated that diabetic individuals were 2 times more likely to develop dementia. It is also noted that 80% of Alzheimer's disease patients have type 2 diabetes. Accumulation of extracellular amyloid proteins is found in both diabetes and Alzheimer's disease patients' brains, and decreased receptor binding of insulin or insulin resistance has been found in the brains of Alzheimer's patients. And this leads to the accumulation of Alzheimer's plaques and the presence of intracellular neurofibrillary tangles. This is why Alzheimer's disease has been called type 3 diabetes. Dementia patients negative for ApoE4 given 20 units of intranasal insulin had improved story recall and improved learning. However, intranasal insulin had no effect on patients with Alzheimer's disease homozygous for ApoE4 and also in non-demented patients. And when given daily, did not slow the gradual cognitive decline of Alzheimer's disease. Lewy body dementia. This is the second most common cause of dementia. In Lewy body dementia, there is decreased basal ganglia uptake of dopamine transporters on the SPEC scan or 18-fluorodeoxyglucose PET scan. Regular PET or SPEC scans show decreased perfusion in the occipital lobes in the back of the brain. MRIs, however, do not show occipital lobe atrophy. Coronal MRIs show less hippocampal atrophy than in Alzheimer's disease, and the EEG has a characteristic feature with diffuse slowing temporal lobe spikes, intermittent rhythmic activity from the frontal lobes. This dementia is more abrupt in onset and rapidly progresses, but fluctuates. It may be accompanied by vivid visual hallucinations in 66% and also auditory, tactile, or olfactory hallucinations and delusions. Depression and anxiety may occur. There may be fluctuating alertness and mental ability, but memory, unlike Alzheimer's disease, may not be affected until later in the course of the disease. Notably, the fluctuations can be subtle or dramatic enough to mimic a stroke or a seizure with staring spells or loss of consciousness and then awakening with blank stares. They can have confusion or weird behavior, disorganized speech, trouble walking, and somnolence, sleeping a lot during the day. Early on, there can be problems driving with misjudgment of distances and missing stop signs or not noticing other cars. They often get lost driving and they can no longer function at work. Sleep disorders with talking in the sleep or violent punching or nonviolent gestures are common during sleep, and this sleep behavior can precede the dementia by 20 years, but it is nonspecific, as it can be seen in Parkinson's disease patients, brainstem lesions, narcolepsy, and as a side effect of SSRI antidepressants. In people on melatonin and clonazepam, this can be suppressed. Mild Parkinson's-like symptoms develop at the same time as the Lewy body dementia in 80% of patients, and also because of dysfunction of the autonomic nervous system. There may be a lot of falls and faintness from the drop in blood pressure when standing, or from cognitive fluctuations. Autonomic dysfunction may also include constipation, bladder dysfunction, and impotence. Trouble drawing a clock or overlapping pentagons is an early sign. They can have attention deficits and can't spell world backwards or subtract serial sevens, 7 from 100, then 7 from 93, etc. There are other rare causes of dementia which are accompanied by Parkinson's features. Progressive supranuclear palsy with the inability to look downward, multisystem atrophy, previously known to me as Shy-Drager syndrome, with a lot of fainting, and another disorder called corticobasilar degeneration with alien limb phenomena, uncontrollable limb, and no tremors. In this dementia, olfactory and other hallucinations should be prompting a workup for partial seizures. To confuse the issue more, Alzheimer's disease and Lewy body dementia can coexist, and also Alzheimer's disease can mimic Lewy body dementia when there is superimposed delirium. We do not use phenothiazines in Lewy body dementia because they have severe side effects from these drugs. Frontotemporal dementia. Frontotemporal dementia, also called Pick's disease, is more often associated with early personality changes, with lack of inhibition and inappropriate behavior such as urinating in public, inappropriately touching or kissing strangers, or passing gas without care. There may be insensitivity to others' feelings with lack of empathy, inappropriate laughing or crying, and this is called pseudobulbar affect, lack of judgment and stubbornness. Psychosis or delusions and hallucinations like Lewy body dementia are less common in frontotemporal dementia. They may have repetitive, compulsive behaviors such as smacking lips, clapping or tapping, hoarding, compulsive cleaning or hand washing, or inflexible food preferences. Gorging on sweets and eating inedible objects may be noted. They may have two forms of primary progressive aphasia with trouble naming objects or understanding words with hesitant speech, or not talking at all with loss of language skills. Inattention, similar to delirium, can be present. Apathy, mistaken for depression, can be present, but they also can be euphoric. Personal hygiene deteriorates and there can be incontinence. About 15 to 20% develop motor neuron disease with muscle weakness, rigidity, muscle spasms, incoordination, dysphagia, tremors that can be seen late in the disease, similar to Parkinson's disease or ALS. There are several variants also of this type of dementia, but all have an insidious and gradual progression. This dementia may begin in the 20s and as late as the 90s, but is usually seen in the 60s. Episodic memory is unimpaired early on. The EEG is usually normal or may show an asymmetrical abnormality. Neuroimaging may be normal early on, but focal, frontal, or temporal atrophy is eventually seen. SPECT scans and PET scans are more accurate than MRIs early on. Differential diagnosis include other types of dementia with concomitant psychiatric disorders or substance abuse, frontal lobe stroke, tumor, trauma, or abscess. About 20% of patients get the disease from a familial autosomal dominant gene. Creutzfeldt-Jacobs disease. Creutzfeldt-Jakob disease, also called mad cow disease, produces a rapid progression of dementia over 3 months. Behavioral problems and sleep problems are prominent early on. Myoclonus and visual disturbances can mimic Lewy body dementia. Very sharp waves are seen on the EEG. Prions ingested from cows, elk, or deer infect the brain, and cooking does not destroy the prions. A spinal tap can show 14-3-3 proteins in Creutzfeldt-Jacobs disease, but encephalitis, strokes, and cancer elsewhere in the body with a brain reaction called paraneoplastic disease can also cause 14-3-3 proteins to occur. Vascular dementia. Vascular or multi-infarct dementia can also start suddenly and intermittently, get progressively worse as more and more damage is done to the brain and more focal, motor, neurological deficits occur. CADASIL, C-A-D-A-S-I-L, is a rare autosomal dominant gene abnormality and an occasionally uninherited spontaneous mutation that causes multi-infarct dementia. Atrial fibrillation can cause a 5% per year chance of large and small strokes and silent strokes with subsequent dementia, but anticoagulants can prevent the silent and large strokes and the dementia. Amyloid angiopathy causes microhemorrhages in the cortex of the brain from amyloid deposits in the small and medium-sized blood vessels in the brain, but also can hypertension in other parts of the brain. Uncontrolled hypertension, cholesterol, or homocysteine elevation, smoking, and diabetes may eventually lead to large and small strokes. It's important to know that 20% of dementia is vascular dementia and can be prevented. Vascular and Alzheimer's disease can often occur together. In my second YouTube video on dementia, I will discuss the many other causes of dementia and the mimics of dementia. I hope this YouTube video has been helpful.